I'm Diarmid Campbell-Lendrum. I'm the head of the Climate Change and Health Programme at WHO headquarters in Geneva. Well, I think in order for this to be a health COP, the most important thing that needs to happen is one of the top recommendations in our report is to recognise that health is not negotiable. These are climate negotiations, people are negotiating finance, technology access and so on. But the one thing that can't be on the table is human health. So the right to health is right at the beginning of the Paris Agreement, and it doesn't say health if you can afford it, health if you know, as a nice to have, it's the right to health. So we believe that that should be the overall framing of the discussions, that everything that we're discussing here should be about protecting people's health, protecting people's lives. And within our report, we have a whole series of recommendations as to how you can do that practically. And most of what we need to do is actually a really positive agenda, so that the things that we need to do in transport systems, the things that we need to do in energy systems and food systems in order to solve the climate crisis are actually really good for health. So we think that the negotiations, the discussions will get a big boost forward if we're able to talk much more positively about the future that we can have if we make the transitions that we need to make anyway. Well, I think that the strongest possible case for renewable energy is the health case. I mean, I'm not sure the extent to which people are aware that we lose about 7 million lives every year from air pollution. Over 90% of the world's population breathes outdoor air that WHO considers effectively unsafe to breathe, that exceeds our air quality guidelines. And for outdoor air pollution, over about 2/3 of that outdoor air pollution comes from the burning of fossil fuels. So it's the same thing which is driving the climate crisis. So if we were able to make that clean energy transition, we would be doing it not just to protect the climate, critical though that is, but it would actually bring massive public health gains. And the economic analysis of this suggests that the public health gains of meeting the Paris climate goals just through improved air quality are about twice the value of what it costs to meet the Paris goals. So the health gains of climate action actually pay the bill for climate action. So we also know that it's something that the average person in the street feels strongly about. People care about their health themselves and particularly their children. Nobody wants their children breathing dirty air. So we think that should be a really primary motivation for this transition that we need to clean energy systems. Well, I think that the COVID pandemic has made clear to everybody the importance of human health. I think if you'd asked WHO 2 years ago that if we had a major disease outbreak, would countries be prepared to go into lockdown, shut down their economies, we would not have believed that would happen. But in fact, human health is so important to people when they can visibly see the threat that it's very clear that societies are willing to make very big changes for human health. And I think that's part of the silo breaking that we need. From the health side, we've been very clear that although we've been treating COVID as a disease that has got into the human population, our response to COVID has to be done in such a way that we also protect the natural environment and the climate. Because if we make economic investments to prop up our economies or to resuscitate them after COVID, that result in more burning of fossil fuels, more carbon emissions and destruction of the world's climate, then that is going to undo all of what we've tried to do to protect people's health from COVID. So it is critically important that we back each other up, that the health community argues for climate action because it's essential and because it's really good for health. And we think it's also critical that the environment and climate community recognizes the importance of health, those health gains, and uses health also as an argument for climate action. Because although as WHO and our partners in ministries of health, we mainly work on curing disease, we actually recognize that the biggest health decisions actually take place outside of the health sector. They're the decisions that are taken about the food that we eat, the quality of the air that we breathe, our access to water and sanitation and so on. So it's also, I would say, on us from the health side to back up all of those sectors that need to make the transition to protect the climate, but that they're also the sectors and the natural ecosystems that we rely on to protect human health. Well, I think that the equity aspect, the equity approach is absolutely fundamental, and we've seen that through the COVID crisis. So we at WHO will sum this up by saying the world has got an A in science. We were able to develop tests quickly. We were able to develop vaccines in record time. We were able to quickly work out that masks were really good protection. So the science around this has been fantastic. We've basically failed ethics as a global community because we haven't been able to put in place the global cooperation that allows the poorest parts of the world to have access to all of those interventions that we know work. It's exactly the same for the climate crisis. So we know that the technologies and the solutions that will solve the climate crisis, that will provide clean energy, sustainable food systems and so on, are less accessible in the poorer parts of the world. We also know that those populations which have contributed least to carbon emissions are most impacted by climate change, including death and disease from climate change. So it's absolutely critical that we approach this globally and to recognize that the rich populations, rich countries, do have an obligation to protect those that are weaker than themselves, but it's also in their self-interest as well. Because unless we protect those populations, the problems that we see occurring in those populations will come back anyway to bite the richer parts of the world. So it's in everybody's interest that we address those inequities and that we basically treat those or protect those who are most vulnerable first. Well, I would say that a couple of findings that are most important for these negotiations are that we do recognise that carbon markets are a possible way of addressing the issue, that putting a price on carbon, all of these market mechanisms are potentially useful tools. But one of the things that we're quite clear on in the report is that we're beyond the point at which we can use markets to basically shift around risk or shift around the burden of dealing with the problem. We do need to cut our consumption of fossil fuels right back, and that means leaving fossil fuels in the ground. And we need that for health as well as for the climate, partly because we already suffer such a high health burden from extracting these fossil fuels and burning them. So I think that some of the messages that we would hope that the COP negotiations would take on board are, first, as I've said, that health is not negotiable. Second, that the recovery packages, which are closely linked to the discussions about finance, the COVID recovery packages, are implemented in such a way as to protect the planet and to protect health. And also we think that along the big tracks that people are discussing here in Glasgow around energy systems, food systems, transport systems, finance, there is a positive health dimension to each of those. There's a positive health dimension to sustainable transport systems. There's a positive health dimension to sustainable energy systems. There's a lot of money to be saved if you stop subsidizing fossil fuel consumption, subsidizing it both financially but also the costs that we effectively play in our lungs. And we think that applying a health lens quite quickly and simply to each of the major tracks of the negotiations will actually spur them on, because it becomes a positive agenda, which is then about investing in a better future for everybody. I think that probably the findings of the report, or the recommendations of the report, that are most important to me personally is the final recommendation of the report, and it's about mobilizing the voice of the health community. Because we have seen right from the beginning of the climate discussions, and going back to Rio, health has been central on paper, and yet I would say that the climate community has maybe not taken enough notice of the health dimension, but also that has not been owned by the health community because they've been busy treating people and so on. And I would say that's now changing. And so the health community is now really mobilizing behind climate action. And so this year there is a letter which has been signed by organisations representing 45 million healthcare professionals. That's about 2/3 of the health workforce. And they are waking up and calling for climate action. We also know that the health profession, doctors and particularly nurses and midwives, are the most trusted profession in the world. And as they wake up and start to mobilise and saying, this isn't only about the environment, it's also about the health of you and your children, then we actually think that can start to see a step change in the way people view addressing climate change.